Yeah, basically, I believe that all people probably benefit from vitamin D because we've become a sun-phobic society. We slap on sunscreen at the advice of dermatologists, and it prevents us from absorbing the sun and making vitamin D. Also, being over the age of 50, having a dark complexion, and being overweight, which are problems in our country, a big problem in our country, being overweight and obese, also decreases vitamin D. So I find in measuring vitamin D levels that many of my cancer patients are deficient. And we seem to know that low vitamin D predisposes patients to develop a number of cancers, and there's some evidence that patients with normal vitamin D level and cancer do better than patients who don't. The other supplement that I highly recommend also comes from deep cold water fish, which might be a source of vitamin D, by the way, omega-3s. I believe that the animal-based omega-3s, DHA and EPA, are anti-inflammatory and also antidepressant to a way, and neuroprotectant. And there is some evidence that in some cancers, patients who are supplementing with fish oil have better outcomes than patients who don't. Calcium, I think, is also an important supplement, and I myself recommend to patients that they decrease or eliminate dairy products, which is the major source of calcium. Green leafy vegetables, tofu, soy products may have calcium, but evidence suggests that calcium decreases the risk of colon cancer, which is a big problem in this country. So I often recommend that patients take a calcium and magnesium blend. I'm also a big believer in medicinal mushrooms. Basically, that's how I got into integrative medicine, is through going to a mushroom festival where I learned about the fellowship in integrative oncology or integrative medicine at the University of Arizona. And I've become quite a proponent of medicinal mushrooms as enhancers of the immune system that may also perhaps have some anti-cancer effect. People say mushrooms, how could they be biologically active? Well, remember, you can eat a mushroom and die, or you can eat a mushroom and have quite a psychedelic experience. So clearly they have biologic activity, and I think we should take advantage of that in patients with cancer.